So we are back to the anterior portion of the heart. When we left off, we had deoxygenated blood going from the right ventricle through the pulmonary artery into the lungs to be cleaned. Now we need to, once the blood is cleaned up in the lungs, it needs to go back into the heart via the left atrium, which is right here. And how the blood flow gets there as it goes through the pulmonary vein. So I'm going to rotate this heart so we're posterior, and we can see there's a pulmonary vein here and a pulmonary vein here. And as we go back anteriorly, I'll open up that left atrium so that you can see this right here, if you can see, is blood flow coming through one of the pulmonary veins, and then the other one, I think I have to open that up a little better for you to see. You can see where it came in here, and I'll see if I can get you some daylight there, right there.
Oh, yep.
Is the other pulmonary vein. So pulmonary vein flow comes into, we'll close this up, comes into the left atrium. Once it's in the left atrium, it needs to go through the mitral valve to get down to the left ventricle. So if we open this up, what we can see here is the mitral valve. Notice again all of these really thick, taut chordae tendineae that attach to these big papillary muscles. This is the anterior leaflet of the mitral valve right here, and you can see it is attached via cords to the papillary muscles, and then right here is the posterior leaflet of the mitral valve. And again, the same thing, you can see that the posterior leaflet is attached to very strong cords and attaching to the papillary muscles as well. So once we get flow through the pulmonary veins into the left atrium, through the mitral valve, and into the left ventricle, it needs to get out to the systemic circulation. And how it does that is, remember, this is the apex of the heart, so kind of the bottom of the heart. Once the flow is there, it needs to get out through the body through the aortic valve. So it goes through what we call a left ventricular outflow tract. And if you watch my finger, I'm winding up through the left ventricular outflow tract. There will be an aortic valve in there. And then if we go through the aortic arch, you can probably see my finger in there. Can you see my finger in there?
Move it this way, the glares.
This way?
Back up that way. This is how Green and Coughlin need to figure out camera.
Here, how about okay. Are you good?
Come this way. There we go. Wiggle a finger.
Hello. So the flow then goes through the outflow tract. There's an aortic valve that it would go through. And if I kind of separate that a little bit, I can feel my finger is right here. So this would be the ascending aorta where it kind of starts to go up before it gets to the arch. Here is the aortic arch. Again, in pigs, it's 2-vessel arch. In humans, it's a 3-vessel arch. So it would go from the left ventricle through the aortic valve, across the aortic arch, and then if we still had the aorta intact, it would go descending aorta and all out to your systemic circulation.